with the new molecule being on the market, how do you see actual results? Are they really making a difference?
So for that, I would use a phrase from Spider-Man: with great powers comes great responsibilities. So these drugs are very powerful. कि आप जीना है इसलिए खाना है. But now all of us are living because we want to eat great food. Everybody will be millionaire around you, but then you will just find one or two healthy people.
Hello all, welcome to AIG Orthopod Podcast series. I'm Dr. Shrinivas T, Director and Head of the Department Orthopedics and Sports Medicine at AIG Hospitals. Today I have my colleague and the Director of the Center of Obesity and Metabolic Surgery at AIG Hospitals, Dr. Abhishek Katakwar. Obesity is a major problem now, and it is being emphasized in our country by even our Prime Minister Narendra Modi ji. And what we see is the usage of the recent drugs, the fat pill, to just you pop it and you can lose weight. Like there are so many drugs which are coming to the market where there's no regularization, and you can see a lot of unprescribed usage of these drugs. It's going to have a big impact in the later times. So for me, I'm not clear still, who is that patient who is the right one to take these medications? And also more importantly, who should not be using these medications? Can you please elaborate on that?
So very relevant to this time when we are flooded with all these weight loss medication. So there are weight loss pills and there are weight loss injections. Now, when we say pills, they are GLP-1 tablets, whereas when we talk about injections, Ozempic, Mounjaro and Wegovy will be launched sooner or later. Unlike Western market and Dubai market where these drugs can be directly bought over the counter, fortunately in India, these drugs will be available only with the prescription. So that's a good part.
But still people are using, right, without prescription.
Unfortunately, they are using it, but still we have this favorable situation where without prescription, because they have to write correct doses.
Okay.
There are different doses for this drugs. So my only concern is this drug should not be abused by people who are just want to lose weight, because somebody wants to lose weight, they are desperate by any measure. But the good thing is these drugs have different doses. So they have to consult a doctor, and it is our responsibility to write the proper doses prescription, not only the doses, but also the danger things, the danger points or the precautions which one should take. Now, speaking of your first question, who can take it? So we have to follow the same guideline which we follow for bariatric surgery. Anybody who has a BMI of 27.5 is a candidate for bariatric surgery. So I'm sure anybody who has a BMI of more than 27.5 can take these pills under supervision of a doctor. Now, speaking of who should not take it. So if you are thinking that you will take these drugs for 3 months and you will lose weight and you can stop these drugs, you are not the right candidate, because this is not a quick fix. These drugs have to be taken for lifelong. The moment you stop this medication, you regain weight. Someone who cannot afford this drug for lifelong, because the cost of this medication each month will cost somewhere around 18,000 to 25,000. That's huge. If you cannot have so much funds, you should not take this medication, because once you stop, it can create more neuroendocrine problems for you. Having said that, the cost of these medication, what you have for 1 year, the cost of surgery is less than that cost.
Right.
So I would always, now we are saying that we are not glorified, but we are cheap.
Okay.
The bariatric surgery is
There's
cheap
no
now.
bias in this, right?
There's no bias in that.
Being a surgeon.
The other thing is somebody who has history of medullary carcinoma of thyroid, somebody who has a history of pancreatitis, somebody who has a history of pancreatic cancer in the family, they should not take it. The other contraindication is now there is something new which has come up, that these drugs can cause intestinal obstruction or gastroparesis, which is nothing but the paralysis of the stomach. So anybody who had previous surgery or any symptoms wherein their bowel is not great, they should avoid this medication. And obviously, somebody who is planning to get pregnant, they should not take this medication.
Wow. So it's not a simple thing, just pop it in.
Yes.
So they have to certainly take the responsibility of speaking to a bariatric. Doesn't have to be a surgeon, somebody who manages obesity well, and then they should start taking it. But I think this is very important, what you said. It is a lifelong medication and it is a very costly medication. There are simpler ways of losing weight, but that needs a lot of compliance. That's where is the key. Okay. So with the new molecule being on the market, how do you see actual results? Are they really making a difference?
Definitely there is a result. So for that, I would use a phrase from Spider-Man: with great powers comes great responsibilities. So these drugs are very powerful.
Mm-hmm.
In fact, to an extent that maybe the obesity problem, the diabetes issue will be resolved, and we are calling it diabesity now, the combination of diabetes and obesity. But the important thing is, if we ignore the shortcomings, if we ignore the problems which one can face by using these drugs, it can create more problems in future.
Of course. So in India, unfortunately, there are not much of regulatory protocols where they can stop people from using these medications. So who is that patient who is correct for taking this medication? And most importantly, who is the one who should not be taking without advice from the doctor?
So let me take you to the Western world first. When you speak about indication, these drugs are available over the counter in US market and in Dubai, Middle East.
Right.
So anybody can go.
Okay.
Without prescription, you can just buy. So I am worried about the abuse of this drug. That's my concern. In India, such drugs will not be issued unless you have a prescription by doctor. So at least patient will have to take prescription and take supervision that, okay, I'm supposed to take this medication.
That's a surprise actually.
Yes. Having said that, in India also we do not have strict guidelines that who can take it and who should not take it. But most of these guidelines are basically, we follow the replica of bariatric surgery guidelines. So we should know first who are the patients, who are the candidates who are fit for bariatric surgery. So we have an indication wherein anybody who has a BMI of more than 27.5 qualifies for metabolic surgery or bariatric surgery.
Right.
So for that, we also have to understand how we grade obesity. So anybody who has weight or BMI more than 25 now are considered grade 1 obesity in India. In fact, compared to Western world, we are more prone to develop metabolic problems even at the lower BMI. So it has further gone down to 23.5. So anybody who has a BMI of more than 23.5, they are at risk of some kind of cardiometabolic problem or fatty liver. So we still do not have guidelines which will define who are the right candidate for this. But I think here is the role of physician like you and me, because most of these people will not directly go to an endocrinologist. They will probably come to you for their osteoarthritis of knee with weight.
Correct.
So this is all about creating awareness, not only for endocrinologists, but for general practitioner, for orthopedician, for spine surgeons, for bariatric surgeons, that whom should be given this medication and whom should not be. Now coming to your second question, where it should not be prescribed. The most important thing is when we talk about any medication. So the important thing here is these medications are for lifelong.
Correct.
So if somebody is thinking that, okay, I will do a kickstart with this medication in next 4 months, I will stop it.
Yeah.
That is going to be a bad thing to happen to anybody, because the moment you stop these drugs, you start regaining not only what you have lost, but even more than that.
Rebound phenomena. So the first thing we should know that these drugs have to be taken for lifelong.
Now, the moment we say these drugs have, I'm going to tell you why you should not prescribe to the people. We'll understand who are those candidates. Now, the second thing is people who are not committed. They have very short-term goals. Correct. You should not prescribe to them. Yeah. The other important factor is the cost of this medication can be somewhere between 18,000 to 20,000 per month.
Wow.
Now, there is a very interesting article which recently came up in one of the journal, which says that the cost of this medication for 1 year is equivalent to the cost of bariatric surgery. So which means that if you're on this medication, you will be spending more money on the drugs rather than you spend on surgery. So the second point here is people you feel that they cannot continue this medication because of the financial burden, you should not prescribe it to them.
Sure.
Now let's come to the medical contraindication. Anybody with a history of medullary carcinoma of thyroid, anybody who had a history of pancreatitis, anybody who has any abdominal surgery, because there's a new thing which has come up that these drugs can cause intestinal obstruction and gastroparesis in some of the patients. So you should not prescribe to anyone who can develop intestinal obstruction or gastroparesis.
There's so many things, right? Not to take.
Yes.
Why not to take?
Yes.
I mean, I find it very difficult for convincing my patients who come with knee arthritis to go and see you. Whenever I say, please go and see my colleague Dr. Abhishek for bariatric surgery, he's a bariatric surgeon, but he would suggest you what to do. A lot of them will be taken back. The first thing they say is, I'm going to diet, I'll try and lose that way, I'll go to that center, this, so many different ways. Why is it so difficult to lose weight?
So let me answer your first question. When people like you, orthopedician, they send patients to bariatric surgeon, why they don't turn up? The reason is, the moment we say surgery, everybody gets scared.
Yeah.
Because they understand that some of them have this feeling that they're not fit for surgery. So we have to tell them that when we say surgery, it does not mean that this is an open surgery. Now, we all know that bariatric surgery is done by either laparoscopy or by robotic. I don't remember when I did my last open surgery, to be very honest. So the first fear they have is about open surgery. The second fear they have is whether they are fit for surgery or not. So in fact, here comes the role of risk-benefit ratio. We have to tell them that you are at more risk than at benefit at this moment of time. But if you take a calculated risk by doing surgery, you have great benefits in future. And how about the next question you asked, why it is so difficult to lose weight? So it's a very complex thing. It's not that easy as it looks. And unfortunately, for years, we have been made to believe that somebody who is lazy and somebody who overeats gain weight. But let me take you on a reverse direction. Somebody who has already gained weight will not be able to lose weight by being active and by doing exercise. Why? Because his calorie requirement is more. So this whole thing of proper nutrition and exercise should come before somebody starts gaining weight. It's a part of preventive thing. It's not part of the treatment. So that's why it becomes very, very difficult when we tell someone that, oh, you start doing exercise, you pay attention to your nutrition and you will start losing weight. They already know that it is not working. They have already tried it several times. Unfortunately, when we put a lot of pressure on them that, oh, no, because you're not doing exercise, you're not doing nutrition part, you're not losing weight. So unfortunately, they tend to lose their hope. So they know that this is one of the modality, but it is not working on them. And to understand that, let me take you back to another reality program which used to happen in US called Biggest Loser. This was a reality show wherein people who are overweight, they were put under like what they have in Big Boss. They were put under supervision, nutrition, exercise. And person whosoever lose the maximum weight will be given the prize money and millions. Now what happened is, this program was stopped because of a lot of ethical issues, because people said that this is more stigmatizing. You're trying to showcase that somebody's overweight, body image issues. So it was stopped.
Unfortunately, reality hurts, right?
Yes. Now what happened? After this program was stopped, a group of doctors thought, let us go back and check what happened to these people who were the winner 6 years back.
Right.
I still remember the name of the winner. His name is Danny Cohen. Now people went back to him and saw that the winner gained more than what he lost in 6 years.
Right.
In fact, to an extent that his problems had become more problematic. And I'll tell you why. Every time you lose weight, you lose muscle and you lose fat.
Absolutely.
But every time you regain, you gain only fat, which is called sarcopenic obesity.
Absolutely, yes.
So the moment you're losing muscles every time, you're going to become weak and weak. And muscles are nothing but the factory where your glucose is utilized.
Right.
So your body will not be able to take that nutrition, utilize it in a proper way, and obviously your mileage will go down, your metabolism will go down. So this guy, Danny Cohen, finally had to undergo bariatric surgery.
Right.
And after that, he tried to maintain it.
So I think one of the major issue when it comes to losing weight is, I think that traditionally, culturally, we are a bit different. Okay. Food has been made that everything, food is the celebration. That cultural change should come. The second thing, as an orthopedic surgeon, I see a lot of patients who come with joint problems. When I say lose weight, the first thing they say is, I don't eat much. And it is very difficult to convince them that whatever they are eating is much than what they need. Thirdly, as you rightly said, sarcopenia is a big problem. When you're a young person, under 25, you get your muscle, you got a higher metabolic rate. Once you get into the middle age, your muscle mass goes down significantly because the way our life has changed, the lifestyle changed, the food has changed, and because of the globalization, we have a big issue. How do you see that?
So for that, we'll have to go back to the history.
Right.
There were only 3 basic needs when the human evaluation happened: sleep, food, and reproduction. Correct?
Yeah.
Now, when you check, all these 3 things are in trouble now. So imagine 1,000 years back, if you were not hunting, you will be hunted by someone.
True.
So basically, if you're sleeping, you're prone to be hunted, but still we used to sleep. Correct?
Yeah.
The food was the necessity. And when you go back into the history, we were all hunters. We were never into cultivation. So that gene called Hefty gene is still persisting in us, which means that if I'm hunting today, I have to consume as much as possible because I don't know when will I have the next hunt.
Yeah.
So that thought process of kal ho na ho is in us.
Right.
The third thing is, as I said, reproduction.
Yeah.
So when you see all these 3 basic things, we have actually corrupted all of them. We have glamorized our food. So our ancestor used to say that कि आप जीना है इसलिए खाना है.
Correct.
But now all of us are living because we want to eat great food. So our hunger, our cravings, and the whole credit goes to all this globalization. I tell everyone that we have been made addicted to sugar.
True.
Over a period of years. There was no need of sugar. There was no need of plain sugar in our life. It was never there. It was never there part of our human evaluation. It is us. Because sugar is a thing which gives you high.
Yeah.
It is nothing but the most readily available drug. And every time you consume it, the next time you need higher doses to get that high.
Yeah.
And that is why we are getting addicted to sugar.
A simple example, kids, when you give them a lot of sugar, you can see the activity after that, right?
Yes.
So we do see that very often. So,
and in fact, there's a lot of peer group pressure because being a surgeon, being a bariatric surgeon, you will not believe my son had not tasted any kind of sweets till he turned 3.
Wow.
Now the next thing is he goes to a play school, and suddenly one day he came home very angry, very upset, and he told me and my wife, "Daddy, Mama, do you know there is a thing called jam? And you guys have been depriving me of that." So we have to understand that everywhere. It's not, I cannot control my kid at every place. So it is a responsibility of the society, responsibility of the school, responsibility of the pediatrician, physician, everyone. It's a combined responsibility that we should not introduce things which will make them more starving and craving for sugars.
I think it is unfortunately how as you rightly said, the globalized market, right? See, as a kid, jam when we used to eat or whatever the sugars we are eating now, maybe once in a while, we used to have our traditional food.
It is more of a celebration for us that time.
Correct. So now that has become normal, okay?
Yes.
Pizza has used to be, maybe in my medical college I might have eaten 2 or 3 times, but now every day my kid wants that. So we have to make sure that they understand the repercussions of what they do now, because obesity in the children is pretty high now. And imagine 20 years down the line, the kind of problems they can go through, all the metabolic conditions, all the musculoskeletal conditions, all the muscle mass will go away. So everything will be changed to fat. So we won't see a world where you see a fit guys, right? So I think that's where the people should understand, as not just the doctors, I think the celebrities, the so-called celebrities, has to be very careful in endorsing these kind of food, and they should endorse for actually normal things, the traditional things. That will make a big difference. Another thing is,
I was listening to a TED talk recently. Very interesting thing. How many millennials you see around you right now? Maybe few, 1 or 2. But after 20 years, everybody will be millennial around you. But then you will just find 1 or 2 healthy people. Because we are not paying attention to a bigger problem which is coming, as you rightly mentioned, childhood obesity. In next 20 years, the generation which is going to be the next generation, they are going to have, in fact, when someone comes to me with childhood obesity, with no history of diabetes or hypertension in the whole family, but this 16-year-old boy is diabetic, has high blood pressure.
True. Unfortunate, right?
So imagine, the credit also goes to the parent. Like what you rightly said right now, pizza and all those things used to be celebration for us. Why? 2 reasons. Our parents couldn't afford it, and we were not having access to these things. Now, as a parent, we always have this guilt that, oh, my parents couldn't buy pizza for me, I should not deprive my child. So that emotional guilt should not be there. The things which are bad, they are bad, whether it is this generation or the next generation or the previous generation. But unfortunately, there's a lot of peer pressure which comes up. So it is very important that as a parent, if you have healthy habits, obviously your child will replicate the same. So I always, whenever someone comes to me and say that, "Doctor, my son is gaining weight," I ask them to go for cycling, play football. I ask the parent, do you do all these things, what you're asking to your kid? So first thing is, you should get on track. You are the biggest motivation for them. If you are not doing it, they're never going to do it.
Absolutely right. So coming back to the bariatric surgery, okay, you made a very good point that the medications which we are getting now, whatever Ozempic, Mounjaro or pills, all of those, they are to be taken lifelong. But if there's a break, then they'll go back to rebound phenomenon, regain more weight. With the bariatric surgery, there was a misconception in the past about liposuction and the complications. But the current advances in bariatric surgery doesn't give any of those complications, right?
So 30 years back, there's a lot of ho-halla about complications of bariatric surgery. Unfortunately, people used to think liposuction is bariatric surgery. Yeah. So you're right, said. Liposuction is different, wherein we suck some fat from your belly and maybe around 10-15 kgs, whatever. But we need to understand the human metabolism. Fat is an essential part of us. It is like a fixed deposit for emergency. So the moment you take out 15 kg, your body thinks that, oh, my fixed deposits are gone. So it has to refill. So they used to lose 15 kg, but the body used to deposit another 15 plus 5 kgs. So when we talk about bariatric surgery, it is not about that we are making your stomach small or something like that. It is all about the hormones change which happen, as I rightly mentioned, GLP-1 and other hormones. So this surgery is very safe now. In fact, the complication rate is less than 0.5%. And the advancement in the stapler, the advancement in the robotics, all these have, bring down the complication rate. In fact, the recovery is so fast that all our patients who have bariatric surgery, even 250 kgs, even 75-year-old, they walk within 6 hours after procedure and they are discharged within 72 hours after procedure. So the first thing is, there are some myths which I would like to break down. Bariatric surgery is not cosmetic surgery. Bariatric surgery is not done by open technique. It is done by laparoscopy, minimal access, or by robotic. So the recovery is very fast. And the another myth people have is you cannot have normal food after surgery, which is also wrong. You can have whatever everyone is eating at home. The only thing which will change is the portion size.
That's very important, right?
Yes.
So being an orthopedic surgeon, I see a lot of patients coming with high weight, overweight, and having knee problems. And when I suggest them to go to a bariatric surgeon, there's always a hesitance. But still, I do my best to send them to that. The one question they always ask is, how safe is it for me to have a knee replacement if I'm a bit overweight? From my side, I would clearly say, if the body mass index is more than 35, the risk of failures are high. So the longevity of the implant will go down. So what is your take? What would you tell this group of patients who come to you with a joint problem and obesity?
So in fact, as we said that sarcopenia is a bigger problem. So all these patients who have osteoarthritis, obviously they also have sarcopenia, weak muscle mass, and their gait is also abnormal because of their body habitus. So I always give them a choice that definitely any orthopedician would want great results. And if we lose weight, the results will be more enhanced and long lasting. So we always advise them to lose weight, and I get a lot of patients from you, and in fact, to be honest, some of them you tell them that if you lose weight, maybe you may not need replacement, or else we can delay it for a few more years, which is very right and very ethical on your part. So I think we need to understand the complexity of the problem here. It is not just the arthritis. We have to go back and see why it happened. What are these secondary causating factors?
Sure. When we think about the weight, how it impacts the joint, even for you to stand from sitting, the force going through the joint is around 3 times your body weight.
Yes.
A run can take it up to 5 to 8 times. A sprinter can go up to 15 times your body weight. So that is the amount of impact you have on the joint because of the weight. So weight management is a very important aspect. I think as a bariatric surgeon, you're doing a great job. And I think we have to bust these myths that bariatric surgery is something bad to the body. It is not. It is a very important surgery, not a cosmetic surgery. It is a metabolic surgery, which makes a huge difference in the person's lifestyle or reducing the complications which can happen from the obesity. Any final word you want to tell our audience?
Yeah, so to conclude, I want to tell you a very important thing, that obesity is no more a lifestyle disorder. As you rightly mentioned, it's a disease. And to understand that, this disease does not give you immediate impact. Like somebody has a heart attack, he has to immediately rush to the cardiothoracic center, get an angioplasty or whatever. He can't say that, oh, let me change my lifestyle and then it will improve. So the danger is not immediately seen when we are talking about obesity, but it's a mother of all problems. So if you treat obesity like a disease by virtue of either medication or by surgery, you're not just preventing one problem, but you're preventing 10 more problems.
Correct. Absolutely. Thank you very much, Dr. Abhishek.
Thank you, Dr. Srinivas, for having me here.
Thank you.